compare to how many doctors are produced annually in the United States, and you will be surprised. United States of America produces 18,000 doctors, medical practitioners annually, only 18,000. But they are all world class. Their average doctor is almost as good as our top doctor, but their average is actually very good. What about us? Do you have any idea in the audience how many doctors we produce per year? Anybody can answer that question? Just we are producing 50,000, 50,000 MBBS medical practitioners in this country every year. Now that's not a lot for the size of our country, but these 50,000 doctors are only a shade better than the quacks. That means something wrong there as well. So India has arrived, yes. India is shining, yes. So everybody here very gung-ho about the India brighter side of the story. I just felt that let me talk that there is a very negative side to our story, and unless we address it, 10 years from today, the world will be laughing at us. So I made a few points which I thought I should share with you as to finding what we can do to address the problem. If you see states of Maharashtra, Karnataka, Andhra Pradesh and Tamil Nadu, we are producing about 75% of the doctors in this country. So these 4 states in our area actually generate 75% of the doctors being produced in India. Whereas the more populous states like UP, Bihar, Orissa, Bengal and Assam, they are having a population of 75% of India. They hardly produce any doctors. That was something seriously wrong with us. There is a very serious mismatch. There is a very serious mismatch. Tell me, a doctor who is trained and brought up in Maharashtra, why on earth would he go and practice in a village in UP? So government of India, all the health ministers keep saying, doctors don't want to go to villages. Why on earth will I like to go to a village in UP and may get raped on my arrival? That means we need to address this problem. There is a serious problem of mismatch. What about the standards of medical colleges? Abysmal, abysmal. What is wrong with our medical colleges? We are not even able to maintain our standards. As one of my predecessors spoke about AIIMS, yeah, All India Institute of Medical Sciences, New Delhi, definitely a world-class organization, definitely a very high benchmark for other colleges to follow. But has any other hospital or medical college actually caught up with them? Not really. Every budget, the health minister and the finance minister keep advertising 4 more AIIMS to be opened up. There is an AIIMS opened up in Shillong. And one of the junior doctors happened to be holidaying there. He decided to have a look at the hospital. World-class facilities, world-class. They have 3 cardiac operation theaters, since that's my area of practice. And they're not even doing 100 cases 2 years after installation. That means equipment of 3 operation theaters is virtually lying idle, and in the course of 5 to 10 years, all that equipment will go obsolete and all that money down the drain. Problem we need to think about. Out of the 50,000 medical seats, 22,000 seats are in the private sector. That means these are medical colleges run by private hospitals, run by private colleges. Most of the owners of these colleges are actually politicians. So some of them take capitation fee in some form or the other, and the other private colleges simply charge a tuition fee of 12 lakhs a year, which adds up to almost 50 lakhs per student per MBBS course. So imagine an economy of 22,000 students, each is paying 50 lakh rupees to become an MBBS doctor. Multiply, I'm not very good at mathematics, but I'm sure this amount is a staggering amount. Where does this money go after all? If this money was well spent, I'm sure Nobody would be complaining. All villages would have good doctors, and we all will be having world-class doctors. But that isn't actually happening. So opening these private medical colleges and medical colleges owned by politicians inherently is inherently wrong. Anybody in the society wakes up to this? No. Is anybody pointing to this? No. I'm sure all of you know that all the medical colleges in Maharashtra private are owned by politicians. Is there a single article in the newspaper? Why is this so? And what is happening to the doctors being produced in these colleges? The other thing to note is, today, the student who decides to become a medical student was actually never meant to become a doctor. It is his socio-economic situation which forces him to get into medical college. Having become MBBS, the parents realize that as MBBS, you got to put your heart to practice medicine, which doesn't happen. So what is the next best thing? Become a radiologist. Why? Because for being a radiologist, you don't need to remain a doctor. You just need to buy capital equipment, which you can afford, and start a business. So our medical practitioners then start into medical business. And that is why all these private labs and private radiology practices are getting a bad name and giving a bad name to all of us. We have nothing to do with this. We have nothing to do with an unnecessary investigation or an unnecessary CT scan. That means wrong people got into the medical school, a wrong person became a doctor, and now the wrong person not only becomes a doctor, but he becomes a super specialized. And that is why we have shortage of top talented doctors in the country. So you have one brilliant guy, but 10,000 mediocre ones behind. And everybody talks about those mediocre ones. What about the training methods in the medical college? You take out a list of top 100 doctors of various specialties in the country and ask them one question. Have they ever gone to a medical college and given a lecture? Any of the top 100 doctors in the country, are they associated in any form, any way with a medical college and medical education? The answer to that is clearly no. What a waste. That means the country and the medical students are being deprived of the very brains who are at the very top, and they are not involved with the training of the next generation of doctors. Very glaring, and I'm sure there are solutions to this. Then who becomes a teacher in the medical college? Have you ever wondered? Your children might be going to medical college tomorrow, or your brothers and sisters will be in medical college tomorrow. Have you wondered who is going to be teaching them? These are the worst colleagues of ours. So the toppers become surgeons or whatever specialists. The fellow who doesn't go anywhere, who doesn't get anywhere, can't get into private practice for XYZ reasons. So ultimately he has nowhere to go but to join a medical college and become a medical teacher. That means the most unacademically inclined and the doctor with the least academic inclination, with no research papers, no research thinking, is now going to be teaching the next generation of doctors. And every passing year, it is only getting worse. And nobody seems to be worried about this. The private hospitals also not worried. How are they going to get the next generation of good doctors? So, one of my juniors is actually working at Christian Medical College, Vellore. He is visiting us. So I just asked him in the passing, what are you guys doing all this? What is happening at CMC Vellore? Because when I was a medical student, I joined Armed Forces Medical College, but those days the gold standard of medical college was actually CMC Vellore. That was the ultimate. The topper students actually went to CMC Vellore. So I asked him a pointed question. Again, this colleague is a cardiac surgeon. So I asked him 3 questions. How many cardiac surgeries does Vellore do per year? The answer was 600 to 800 open heart surgeries per year in 2015. I do 700. I have no infrastructure. Do you know in Mumbai, we are all from Mumbai. How many open heart surgeries are performed at Sion Hospital per year? 200 per year. KM Hospital does about 550 to 600, and all the 4 public hospitals put together in Mumbai are doing only 11 to 1200 open hearts a year. See the amount of infrastructure, see the amount of salaries being given, and see the number of trainees who are going through this. Sion Hospital does 200 open hearts a year, but they take 3 trainee cardiac surgeons a year. That means at any given point in time, there are 3 first year, 3 second year, and 3 third year trainees. Total 9 junior doctors are getting trained, and they're going to get trained on 200 open hearts per year in that hospital. How will that doctor become a good cardiac surgeon? Simply no chance. Coming back to the Vellore example, 800 open hearts per year, and they also have 9 students per year, which means each student is getting exposure to less than 100 open hearts in the whole year. So I asked my visiting person the next question. So how many sternotomies does a student actually get in a year? The answer was 30 to 40. How many internal mammary harvests does a student get in a year? Not even 1. Serious problem, serious problem. All of us need to introspect and find out, is there a way forward? And there's one more last problem before I give you the solution. The medical regulators of the country. Now forget the name, Director General of Medical Services or Director General of Food and Drug Administration, that's not important. But see how they also operate. There is a procedure called TAVI, Trans-Arterial Valve Implantation. I'm sure most of you must have heard in the best medical journal. The Times of India is the best medical journal. So TAVI is a procedure which is the aortic valve implantation without opening the chest, meant for patients who are in their 90s and 100s, who have a lot of comorbid conditions and a very high risk case for regular open heart surgery. In the United States, 100,000 TAVIs have been completed in the last 10 years, and in Germany alone, 48,000 have been completed to date. That means today just American and German data on TAVI is 148,000. So that is the kind of database followed up for 5 years. So today we have in the literature what is the mortality with TAVI, what is the morbidities, how many patients are requiring pacemaker, how many survive 1 year and how many survive 3 years, and how long the valve lasts. So we have the data. 2 companies are involved with it, Medtronic and Edwards. They apply for TAVI to be made available in India because people like us are very keen, because we are seeing patients in 80s and 90s coming to us for surgery. So we give them a recommendation letter that this is the established procedure and it's to come in. After 18 months of application with the Director General, the Director General office sends a letter to both the companies, please conduct an Indian trial, 30 patients to be done by each company, and we will then analyze the results and then we decide whether we give you the permission. And all these 30 valves have to be provided free of cost. Each valve is 20 lakhs rupees. So tell me, is it possible for any medical devices company to spend this kind? Why do we need to reinvent the wheel when the West has already done it for us? Do I have a say in this matter? No. I wrote that this is ridiculous. And the company has letters from the top 10 surgeons, 10 cardiac surgeons of India, but nothing happened. And now, of course, with pressure, 3 years from the time of original application, the permission has been given to one of the companies, but with lots of ifs and buts attached to it. So this is the world, this is the country we're living in, and we still dream India will be there. India will be there. We need to privatize a lot of things. We need to privatize the government. We need to privatize the regulators. And we need to privatize the way a private practitioner thinks. My survival and my future depends upon only one thing, my performance. I need to be on daily wages. I need to have incentive night and day to perform. Tomorrow, when I don't perform, I don't get a salary. So similarly, the world, so having given you all this serious and lot of negative